So you've heard me talk a lot about inflammation and how that is the root cause of most diseases that you're dealing with and in our country. So if you look at the top causes of death, heart disease is 99% related to inflammation of the arteries in your heart. So cholesterol doesn't stick to arteries that aren't inflamed. People don't have heart attacks that aren't inflamed. Inflammation is what starts this cascade of heart disease. It's the same thing with high blood pressure. High blood pressure is inflammation of the large arteries. And then you take something like cancer. Cancer genes are turned on because of a pro-inflammatory state in your body. They're saying Alzheimer's now as type 3 diabetes, which is inflammation in the brain, causes these beta amyloid proteins. And then you have things like joint pain. Guess what? Inflammation. You have things like thyroid problems. Guess what? Inflammation. There's so many inflammatory conditions, and there's so much inflammation in your body. So over the years, I've been talking about how to eat an anti-inflammatory diet, and that's great, and things like fish oil for reducing inflammation, and that's great. And I'm really excited to announce there's some new things that we're going to be doing, taking that a step even further and finding out why you're having all these weird symptoms that are related to inflammation. So it's called histamine overload. So you probably think of histamine as like allergy issues. So Benadryl is an antihistamine, right? So it stops your runny nose. But that's not all that it does. Histamine actually has 4 types of receptors all over your body. Now, can histamine overload cause allergy symptoms? Yes, 100%. So that would be right here. So this is a histamine intolerant symptoms. It can affect all of these different organ systems. It can affect your brain. It can affect your lungs. It can affect your reproductive system. It can affect your skin. It can affect your digestion. It can affect your joints. So I'm going to go through some of these today. And the good news is there's a test where you can find out if you have histamine overload. So I was talking to someone recently about this, and we were saying, so if you're allergic to ragweed, and you would say, I'm not. But if you threw ragweed in my face all day long, I would eventually develop an allergy to it. But it took pounds of it. But for you, it just took going outside. Now, why is that? Why is it that it took so much less for you to be triggered with all those allergy symptoms than me? And that the answer I would say is because you have a bucket that's full of histamine. That's why it's called histamine overload. This stuff gets circulated through your system. It doesn't get flushed out. So when you don't get symptoms until the bucket spills over. Well, your bucket's always full if you have these symptoms I'm going to go through. So our goal would be to reduce the amount of histamine in the bucket. Okay, that's the idea. So here's what a full bucket of histamine looks like. So if we just stick with the allergy stuff we were talking about. So hives and rashes or eczema, itchy skin, all of those things with skin, but then over the breathing issues too. So that's going to be asthma, sore throat, allergy symptoms like post-nasal drip, where you feel like you always need to clear your throat, bags under your eyes, all of those things, difficulty breathing, chronic coughing or congestion in your chest. Those are all signs of histamine overload, okay? But then it doesn't stop there, because then you look at what it does to the brain. One of the receptors is in the nervous system, which is your brain. So that's headaches, migraines, vertigo or dizziness. So if the room is spinning, or if you get intermittent vertigo issues, insomnia, anxiety, the circadian rhythm problems is like, that's insomnia. You're not able to get to sleep and stay asleep because histamine overload affects the brain as well. And then you go over here to your cardiovascular system. So racing heart palpitations, arrhythmias, all right? Arrhythmias would be things like AFib and those things. And then you get into the digestive issues down here. So nausea and vomiting, stomach pain, acid reflux, Crohn's disease. All of those things can be caused by too much histamine. And the thing is, if you have that problem, there's some things that you can do, immunotherapy that you can do to reduce that burden. And the cool thing about it is I've actually formed something called Axiom Integrative Health. So we have a nurse practitioner who's going to start providing a lot more services for you guys. And really what spurred this is I got tired of sending people out to doctors, and the first thing they would do with our patients is ask them if they want a shingle shot. Like I sent them there for blood work, right? So that I could use to look at their cholesterol, and they're badgering them about a shingle shot. So our nurse practitioner is going to be doing a lot more primary care services as we get going, but we're starting with this histamine overload testing because it's a huge part of your health. Now the good thing about it is it's covered by most major medical insurances. So she's going to be in network with those people. So all of Medicare, all the Medicare Advantage plans, all of those, Blue Cross Blue Shield, all of those that actually covers the testing. And if we find out that you're positive, you have a histamine overload, you can do some immunotherapy, which reduces your histamine overload, and that's actually covered by insurance too. So if you want to do that, you could talk to one of us at the front desk and let us know that you're interested, and we can find out if you're eligible for it. But it helps so many people. Now, one other thing I want to talk about that you don't think about, that where this cause where this problem comes from is muscle and joint pain. So muscle and joint pain, fibromyalgia. So like arthritic pain, again, it's inflammation, right? So if you have a chronic histamine overload, these things in your system called cytokines go through the roof, and that's what causes pain and inflammation all over your body. So your bad shoulder, your bad knee, your bad hip can largely be attributed to a histamine overload if that's your problem. So that's really simple test that you do. It takes about 10 or 15 minutes. Our nurse practitioner is going to start doing this soon. And so if you need help with that, then just let us know and we'll get this test done for you. It takes about 10 or 15 minutes. And again, covered by those insurance plans. So this can be a huge help to your health if you have any of the symptoms that I just talked about. So let us know and we'll get you on the road to healing.